On to Chapter 8. This is the appendicular skeletal system. This is the skeletal system that is not the axial, I guess you might say. This particular picture has both on it, side by side. There is one particular picture I was looking for that's in an older textbook where they have it color-coded, where you can see the axial in one color, the appendicular in another. And that's always really nice because a pretty common lecture or lab question is to ask you a bone and ask you whether it's part of the appendicular or the axial skeletal system. Now understand, for the most part, for many people who teach A&P, this particular chapter and also the axial skeletal system chapter, but much more so this chapter, tends to be something that we focus on in lab. We certainly have many models that are useful to help us focus on it in labs, so it tends to be more of a lab type, lend itself toward lab, but doesn't mean that it can't be on a lecture test also. But the appendicular skeletal system, think of it as your ability to create movement. All of the movement that you have done throughout the day or you plan to do as you go forward is going to be thanks to your appendicular for the most part if you're progressing from point to point. So if you're picking something up, you're walking, you are driving, you are gardening, whatever you're doing, it's the appendicular skeletal system that for the most part is doing that work for you with its relationship to the axial. The appendicular skeletal system are your appendages, so your arms and your legs, the bones that make up your arms and your legs, plus your hands and your feet. And the girdle area, and we call the girdle area, is the area that attaches to the axial skeletal system. And that's considered a girdle area in my mind. I'm not exactly sure why your book thinks it's a girdle area, because there's an incredible amount of soft tissue also. That helps me remember that there is important soft tissue there also. If you've ever had a problem with your shoulder, which most of you are of the age where it's a shoulder problem you would have as opposed to a hip problem. When you get older, you could have a hip problem too. But if you ever had a problem with your shoulder because you did sports or you did a lot of times it's because of sports, you realize there's an incredible amount of soft tissue that a orthopedic surgeon can do something with, or a physical therapist can look at, or whoever the specialist was that you happen to see for your shoulder problem. The appendicular skeletal system is the clavicle, the scapula, humerus, ulna, radius, carpals, metacarpals, phalanges, the hip bones, otherwise known as the coaxial bones, femur, patella, tibia, fibula, tarsals, metatarsals, and phalanges. You have the whole shebang here that makes up the appendicular skeletal system. We will talk about them a little bit individually, but the actual processes and the spots on the bones, again, they are something that you physically want to be able to identify. Hearing about them might help you get it in your head, so that's a fine thing. But actually seeing them and labeling them using the practice pages or getting in and looking at the models is probably the best way to learn this stuff. First thing we're going to talk about is the pectoral girdle. Speaking of the shoulder girdle, it's made up of the articulation of the head of the humerus. Remember, we're talking about long bones for the most part in the, well, not remember, I didn't say this, but we're talking about long bones for the most part in the appendicular skeletal system. And long bones are going to have two ends. Each are called epiphysis. And the end that's closest to the midline is going to be the proximal. The end that's furthest from the midline is going to be the distal. So the proximal end, which we consider the head of the humerus, is going to articulate with the an indentation, a fossa in the scapula, and that fossa is going to be made more cup-like with soft tissue. And then whenever you have bones coming together, you have to have ligaments holding those bones together. And if you add the ligamentous connective tissue to this, if you have cartilaginous connective tissue, ligamentous connective tissue, you have muscles, and then you have these bones coming together. All of that together generally is what what I consider the shoulder girdle. Hopefully your book considers that also, but we will see. We'll see based on feedback I get from you guys, I guess. Provides arm movement, and the arm can move in 360 if it's healthy. So the movement is circumduction that makes this a ball and socket joint. And you do learn that next chapter, but it doesn't hurt to start learning things a little bit different. It consists, the shoulder girdles, I guess you might say, consists of the 2 clavicles, one on either side of the manubrium, 2 scapula, and then also the humerus on both sides. The clavicles form a joint with the manubrium on the medial aspect, and the scapula on the lateral aspect. We call that the acromial end of the scapula. Shoulder girdle is what we're talking about here, and that would be otherwise known as the shoulder joint or the pectoral girdle. A little bit more about the scapula. You have some distinctive features, and I call the other thing, that's the glenoid cavity. Sorry, that articulates for the humerus. I misspoke. But you do have a fossa, a subscapular fossa, and that most of the time, and particularly on the scapula, these processes are going to be places that muscles are going to attach. Your scapula, or your in layman's terms, is called your shoulder blades. And all you have to do, if you sit there, you can move your shoulders and you realize how many muscles are probably attached. Muscles to be learned are attached to your scapula. It's flat, triangles, forms a joint with the arm and the collarbones. It has a body, it has processes, so the body has several borders, medial, lateral, and superior border. It's an angular type bone, so you have a superior, inferior, and lateral angle. It's the coracoid and the acromion process that become noteworthy. The acromion process is the higher, the more superior one. The word acromion did get cut off of this slide. So you can see where it says coracoid process, the acromion process is the other one. And it again forms a joint with the head of the humerus to form the shoulder joint, part of the shoulder girdle. And here's a posterior view of the scapula, which is always nice to see. Anterior, posterior, see other features. In the posterior view, you do see the spine, and you do have another fossa, a major fossa on the scapula. By the way, the reason you have scapula with an AE on the end, that's plural. And when you don't have the E on the end, you're speaking singular, and it's more or less pronounced the same way, no matter whether you're speaking singular or plural. The coracoid process is considered more anterior than the acromion process. It's smaller, and the acromion process articulates with the clavicle and forms what's known as the acromioclavicular joint. And I always like introducing that because that really shows you how well medical terminology helps you. Many joints are so named where they will talk about, they will merge together the names of the two bones with that combining vowel, the O. the AR at the end is pertaining to, and so this joint pertains to the union of those two bones, so the acromion and the clavicle. And this does tend to be separated, where you have an AC joint separation, and it tends to be separated if somebody hits you from the front, so hits you A to P. If they just knock the side of your shoulder, they'll actually separate those joints. Because the joint on one side, because the bones are held together by ligaments, and if the ligaments get stretched, then there you go. The humerus is the upper arm bone, and with regard to the humerus, it is part of the pelvic girdle. The upper portion is considered the head of the humerus, and on the head of the humerus you have tubercles, greater and lesser tubercles, as well as a groove between. And what the tubercles are attachments, places of attachments for muscles, and the groove in between is for a tendon to ride in and make sure it stays in place. Unfortunately, if in fact you have an anomaly in your bone and the groove is not as deep as it should be, that tendon can slip, and that can create some serious problems for you. On the distal and then in the shaft you have the tuberosity for the deltoid. This is an attachment for your deltoid muscle, which you're probably very familiar with. And on the distal aspect you have condyles, and then you have spots on top of the condyles, so epicondyles, lateral and medial. And that's the way you can tell whether this bone is anterior or posterior in terms of its presentation. This happens to be an anterior surface. Remember, we are speaking in anatomical position. With regard to that, those areas between the medial and lateral epicondyle, you have two other major processes, the capitulum and the trochlea, and they are considered the condyles proper, whereas the lateral and medial epicondyle are upon or on top of the condyle of the humerus. And then posterior aspect of the humerus, you have, again, in the distal portion, you have a major fossa called the olecranon fossa, and this is where the ulna is going to fit in to form the joint we consider the elbow joint. You can again see the medial lateral epicondyle, how they actually help to create the elevated portion so that you can have that fossa. That fossa is fairly deep, and the head of the ulna fits in, has a trochlea or a notch, and will fit right in there and make the joint. And then this one, we'll get started on the forearm. Speaking of the forearm, and hopefully we can get through this. As you can see, again, there's a lot to know in this chapter, but it is meaning be able to identify on the skeleton what these places are. Certainly understand a little bit what they do, but if you know what they are, you are probably going to be okay with what they do also. The forearm is called the antebrachium. It consists of two long bones, the ulna, which is medial, and radius, which is lateral. And as I said, the ulna has what's known as the olecranon, and that's at the head. And I don't believe we're quite seeing the olecranon on this one. Hopefully we have another one to see the olecranon. I think I'm going to leave it here and pick it up on this one on the next portion.